Upper blepharoplasty is a surgical procedure that removes excess skin from the upper eyelids and, when necessary, refines the underlying tissues to create a more open and refreshed look. In this video, we explain what upper blepharoplasty is, why upper eyelids droop, who may benefit from surgery, and what to expect in terms of recovery, results, and cost. Upper blepharoplasty is a surgical procedure that removes excess skin from the upper eyelids area and, when necessary, reshapes small fat deposits that contribute to eyelid heaviness. It is recommended when excess skin creates a tired appearance, hides the natural eyelid crease, causes makeup creasing, or partially obstructs peripheral vision. However, it is not intended to treat temporary swelling caused by allergies, fatigue, or short-term fluid retention. Upper eyelid drooping usually develops due to a combination of anatomical and age-related factors. Loss of skin elasticity, known as dermatochalasis, allows loose skin to fold over the eyelid. Small fat pads may also become more visible, creating fullness. In some patients, brow descent or genetic predisposition can worsen eyelid hooding, sometimes appearing even in early adulthood. Not every droopy eyelid is caused by the same problem. Dermatochalasis, or excess skin, is the most common and is usually treated with upper blepharoplasty. In other cases, brow descent contributes to hooding and may require a combined approach. True ptosis, where the eyelid margin sits lower due to muscle weakness, may require a specific corrective procedure in addition to blepharoplasty. Ideal candidates typically have visible eyelid skin excess or hooding at rest and feel their eyes look heavy or tired. Patients should have stable eye health and realistic expectations about natural results. A detailed evaluation is important, especially if dry eye symptoms, significant ptosis, or brow descent are present. There are two main surgical approaches depending on the cause of eyelid heaviness. Standard upper blepharoplasty removes excess skin and reshapes small fat pads. The incision is placed in the natural eyelid crease so the scar heals discreetly. When the issue involves eyelid muscle weakness or brow descent, the procedure may be combined with ptosis repair or brow support to achieve the correct result. Upper blepharoplasty is performed under local anesthesia with sedation and typically lasts between 45 and 75 minutes. The surgeon carefully marks the eyelid crease, removes the planned amount of skin, and conservatively reshapes or repositions small fat pads if necessary. The incision is then closed with fine sutures designed to minimize visible scarring. Before and after results usually show a cleaner eyelid crease, reduced hooding, and a more open appearance of the eyes. The goal is a natural improvement rather than an overcorrected or artificial look. In the early days after surgery, mild swelling and bruising are common. As healing progresses, the eyes gradually appear brighter and more refreshed. Recovery is usually well tolerated. During the first 48 hours, mild swelling and bruising are common. Most patients return to normal daily activities within 5 to 10 days. Over the following 3 to 6 weeks, residual swelling settles and the eyelid crease becomes smoother and more natural. Protecting the incision from sun exposure and avoiding strenuous activity during early recovery helps support optimal healing. When performed by an experienced surgeon, upper blepharoplasty is considered a safe procedure. Common temporary effects include swelling, bruising, mild dryness, or a feeling of tightness during healing. Less common complications may involve prolonged swelling, temporary discomfort when closing the eyelids, or visible scarring in patients prone to hypertrophic scars. Serious complications are rare when proper assessment and surgical technique are used. In the UK, upper blepharoplasty typically ranges from about €3,000 to €4,500. The final cost depends on surgical complexity, whether fat reshaping or combined corrections are required, and the surgeon's expertise and clinic standards. In mild cases, non-surgical treatments such as laser resurfacing, radiofrequency tightening, or dermal fillers may improve skin quality. However, these options cannot remove significant excess skin. When upper eyelid hooding is structural and visible at rest, upper blepharoplasty remains the most definitive solution. Upper blepharoplasty is not just a cosmetic eyelid surgery. It is a procedure that can improve upper eyelid heaviness, restore a more open appearance, and reduce the functional discomfort caused by excess skin. If you're considering upper blepharoplasty, visit our website to request a free personalized consultation with our team and receive a specialist evaluation tailored to your case.